Hi guys, it's Melissa McIntosh here, and I just wanted to jump on and do a quick video. I've had a lot of questions recently, and people are asking me, what does a therapy session look like? And how do I know if I need therapy, if that's something that's appropriate for me to do? Tell me a little bit more about that. So I just wanted to jump on and create a quick video and just share with you guys some of the insights about therapy that I have. So one of the common misconceptions about therapy, people will say things like, I don't need to see a therapist because I'm not crazy. I always try to correct that type of language and those kind of conversations because I don't like to talk about people and label people as being crazy. So situations can be crazy, things that happen to us can be crazy, outcomes can be crazy. People are not crazy. People are where they are. People may have specific diagnosis. People may have certain stressors that they're dealing with, or certain responses based on their experience to certain stressors, but people are not crazy regardless of the diagnosis that they have. Also, I like for people to know that mental health is on a continuum. So depending on what kind of stressors that we are experiencing and what kind of trauma we've had in our past, we may be more mentally well or less mentally well. It's a continuum. So we're not just this diagnosis or not this diagnosis, or whatever the case may be. We may be responding really well and coping really well to the stress that we're facing in our life at one point in time in our life, and then other things can come along and complicate that. So depending on how much stress that we're under, depending on what exactly we're dealing with, depending on things like grief or different seasons in our life, or the level of responsibility that we have, or how physically well we're doing, or how well we're taking care of ourselves, we may be able to manage the stress that we're under better in certain seasons than in other seasons. So therapy is a way for us to get support and to get the resources and tools that we need to identify our feelings, to process and talk about our feelings, to manage our feelings, and to be the healthiest version of ourselves. So there is no requirement that we have a specific diagnosis to be appropriate for therapy. There's still a lot of stigma in the world that we live in today around therapy. And what I like to tell people is that everybody needs a therapist. I need a therapist, you need a therapist, your kids need a therapist. We may not consistently need therapy across the board for our whole life, every single week or every other week for the rest of our lives. But there are going to be periods and seasons in life where we are going to be uncertain and we're going to be unsure, and the stressors that we are experiencing are outweighing our ability in that moment to cope with what we're dealing with. And it's in those moments that we need someone who can come alongside us. And what your therapist is a neutral person. So when you're talking to your therapist doesn't have a lot of emotion that's wrapped up in the things that you're discussing with them. They don't have a lot of buy-in. It's not going to affect them a great deal whether you do this intervention or you don't do this intervention, whether you change this behavior or you don't change the behavior. So the therapist is a person who can step outside of the situation and monitor the situation and give you insight, tell you what they see, and offer some practical problem solving strategies, offer some typical coping methods that seem to work for people. The therapist can help to assess, to determine what you're really dealing with. And sometimes they can see underlying issues. They can also help you get to the bottom of underlying issues that you may not have even realized that were contributing to the problem. They can help with communication skills. They can help with problem solving. They can help with recognizing emotions and processing those. We talked about that a little bit earlier. But there's a lot of things that can happen in a therapy session that can help you to manage and navigate the challenges of life, whether you're a new parent, whether you are facing a season where you're going into retirement, you're not sure what your identity is outside of your work, if you are struggling with school, if you have had loss and grief, if you are having a difficult time in a relationship, an intimate relationship, if you are expressing yourself in a way that's not really who you want to be, if you're screaming at your kids and you're frustrated and you're overstimulated and you're at your wit's end and you just don't know how to do this anymore, a therapist can help you with practical goal setting, and they can help treatment plan, and they can give you homework. And so there's a lot of different things that a therapist can do, and it's very widespread, and it really just It just depends on what it is that you need individually. So when you sit down and you talk with your therapist during the initial session, they are going to do what's considered an informed consent. They're going to tell you, this is what you can expect from therapy. This is what this therapeutic relationship looks like. This is your part of what we're doing here, and this is what you can expect from me. And they're going to explain things like HIPAA and confidentiality, and they're going to explain privacy practices. They're going to talk about their fee schedule and whether or not they accept insurance and some of those kind of things. And if you have a good therapist, they're also going to let you know if this isn't a good fit, if our personalities don't click, then I can refer you to someone else, because one of the most important factors in therapy is that you have a good relationship with your therapist. Also, during that first session, the therapist is going to gain some information about what life has looked like for you up to this point. Some information about what your childhood looked like, if you experienced trauma or adverse childhood events, if you have ever experienced any kind of abuse or neglect or harsh parenting or whatever that situation might be, how well you did in school, moving up, did you meet regular milestones throughout your childhood? Have there been difficulties in childhood that have kind of changed the way that you see yourself? And then the therapist is going to look at your, are you married? Do you have children? What is your relationship with your mom and dad like? How many losses have you experienced in your life, and how have you coped with the difficult seasons and the things that you've been through in the past up until this point? And so that's some of the information that the therapist is going to draw from you. She or he is going to look at different symptoms that you're dealing with today or in the last 2 weeks. And they're going to ask questions like, in the last 2 weeks, have you been tearful? Have you been anxious? Have you felt paranoid? Are you suspicious of other people around you? Are you irritable? How is your sleep? How are you eating? How is this issue showing up in your life, and what is your major complaint as of today? And then based off of all of the information that the therapist gathers, you and the therapist will sit down and create what's known as a treatment plan. You will review that treatment plan and you'll talk about, okay, these are going to be the goals. These are the goals we're going to set, and this is how we're going to attempt to achieve these goals. This is how we're going to know if we're achieving these goals or not. And then we're going to review these periodically, and we'll update these as needed to better reflect the progress that you're making or any changes in your life that have occurred since the last time that we've been together. So that gives you just a little bit of information about what you can expect from a therapy relationship and what you can expect in that first session, and whether or not therapy is right for you. So if you're in a season, you're just having a hard time figuring out who it is that you even are anymore, you're not really knowing how to cope with things, you find that you're having a tendency to isolate, to pull away from other people, you're just not really feeling like yourself, and maybe you're having anxiety, maybe you're having loss of appetite, or your appetite's greatly increased and you're eating more to try to cope with the feelings that you're having. You're sleeping more often, or you're sleeping less. You are having trouble going to sleep, staying asleep, or sleeping too much. Any of those kind of things that you could be dealing with. If you're having it's really noisy in your mind and you're having a hard time just quieting that down and having some peace inside of yourself because of this dialogue that's taking place internally, then that's a good indicator that it would be a good idea to talk to somebody. Now with grief can be very complex, and navigating grief, depending on the severity of the loss, can be very difficult as well. And so if you've had a big grief experience in the last ever. Sometimes we stuff grief and we don't actually deal with the grief, and we don't process it, and we don't manage our emotions. So if you've experienced grief, it's always a good idea to talk to somebody who has some experience in grief and loss. They can kind of help normalize some of what you're going through, validate what you're feeling, and then help you figure out, is this okay? Am I okay? And what do I need to do to feel better emotionally and to show up as the best version of myself and the most powerful version of myself? So if you guys have any other questions about therapy, or if you would like to look into possibly getting a session with me, please reach out. My email is southernkytherapy@gmail.com. You can send me an email and reach me there. And my Psychology Today profile is up and running, so you can find out a little bit more about me and how I approach the therapeutic relationship on that profile. I will be getting my my website updated soon, and we will be moving forward into accepting more clients and trying to help more people. I hope to get some more groups going soon and offer those in the community. So just get in touch, and I will share more videos as more things are kind of coming up that people have common questions about. So you guys have a wonderful week, and reach out if you have any questions. Thanks.